first, let's talk about the problem. Heart failure is huge. There's 5 million people that currently have heart failure in the United States. It's the most frequent cause of hospitalization in adults that are 65 and older. It's estimated that more than 1 million hospitalizations will occur because of heart failure, and the cost of heart failure is huge also, $32 billion a year, and it's expected that that cost will double by the year 2030. 25% of patients that are hospitalized with heart failure will be readmitted within 30 days of discharge, and that's a huge problem. Patients aren't getting it. Studies have concluded that readmissions for heart failure could be prevented in 40% of cases. That means that something in the system is failing, and either we or the patient's not doing their job to prevent these hospital readmissions. Unnecessary readmissions contribute significantly to the cost of the disease, and this has become a very big problem for our payers like Medicare and private insurance. Let's talk about that. Hospital stays are expensive. The mean cost of admission is anywhere between $11,000 and $13,000, and more if they stay longer. So patients are leaving sooner. The average length of stay back in 1990 was about 8 to 9 days, and now the last time we kept track in 2009, those stays are down to 5 days, and probably now we're probably even dropping that down to 3. So it's paramount that we do all the right things to keep these folks out of the hospital. So we need to look at transition of care. We need to look at, are patients really ready to go home? And now there's a penalty. Our payers like Medicare are now monitoring excess readmissions. And so hospitals are getting a report card. And if they have an excess amount of readmissions for heart failure, meaning patients are getting readmitted within 30 days, Medicare will not pay the bill. So the hospitals have to absorb that cost. And if they continue to have excessive readmission rates, there's a penalty. So they now get no payment for the readmission, and they're getting a reduced payment for all CMS patient admissions, whether it's heart failure or not. So Medicare is saying, we won't pay you the amount of money that you're supposed to get. We're going to keep part of that money. So hospitals are really focusing on heart failure care and heart failure discharge planning, because this disease is very costly, and we know it's not going away.